My name is Deyanira Nevarez Martinez, and I am a sixth-year PhD candidate at the University of California, Irvine. Before I start, I want to thank CARE, I want to thank the UC, I want to thank Savannah Miller and Kathleen Irwin, Dana Tsagzabe, Dane Wechsler, and my mentor, Jasmine Payne, and my academic advisor, Dr. Victoria Basolo. Here is a bit about me. I am the daughter of Mexican farm workers. I grew up on the Migrant Trail between Gilroy, California, and a small border town called San Luis, Arizona. I lived with my family of 5 in a 1-bedroom trailer that my parents parked in a vacant lot where they built a home little by little over 8 years. Our experience was not unique. This is the long-standing tradition of families that live in informal settlements along the US-Mexico border called colonias. To many people's surprise, colonias on the US side of the US-Mexico border often lack running water and electricity. And I became an urban planner in great part because of these experiences, and it's one of the reasons why my work focuses on informal and precarious housing. For those of you that don't know California, the Imperial Valley is at the geographic bottom of the state on the US-Mexico border. It also borders the county of San Diego to the west and Yuma County, Arizona to the east. It's a rural agricultural center for the state, accounting for a big chunk of California's and the nation's winter crops. Here you can see the community's demographics. It is overwhelmingly Latinx, specifically Mexican, 85%, and with a total population of about 181,000 people. The area has seen a consistent rise in homelessness over the last decade. However, in 2016, there was a huge uptick, and it has continued to rise since then, except for 2019, when we saw a reduction of 80 people. The results of the 2020 point-in-time counts, which is where all of these numbers come from, was supposed to be available in June, but because of COVID, they have not been released. But we expect that the 2020 numbers will see another uptick because of COVID. Here are some images of what homelessness looks like in the valley. Some of it is typical in what you have undoubtedly seen, hanging out by the bus station or on the side of the freeway by the Motel 6, but some of it is more unique to the area, like the picture on the far right, where someone has set up a camp by an irrigation canal. So now that you know where we are and what homelessness looks like here, let's talk about my research question and what I'm addressing with my study. My research question is, what are the challenges facing public and nonprofit street-level bureaucrats delivering housing and services to homeless residents in Imperial County? But before we get to the findings of the study, let's talk a little bit about the pivots that I had to make because of COVID. The research question I just read you is not the question I started with. The data that I was able to collect for this study was not the appropriate data to answer my initial question. If you've been following the COVID crisis, you know that low-income minority communities have been the hardest hit. As such, Imperial County has been one of the most affected areas in the entire state. Several things have contributed to this, but probably the biggest factor being the daily back and forth of people at the border. As people started to get sick, many US citizens that reside on the Mexican side of the border in the city of Mexicali, which has a population of almost 700,000 people, started to come across to the valley seeking medical assistance. Imperial County is much smaller and only has one hospital that quickly became overwhelmed. At one point earlier this summer, the area had the highest infection rate in the world. At that time, Imperial County topped the Howard Center's list of the 43 most vulnerable counties in the nation, which also highlighted a pattern of the pandemic in which people of color have been the most impacted. Needless to say, I was not allowed to travel for research there. My initial design had me speaking with both street-level bureaucrats and residents and completing participant observation. After COVID restrictions were imposed by the IRB, I had to adjust and was limited to the data that I could collect from afar. This meant mostly phone interviews and data that I was able to gather online. I should note here that my network became very important for this. I had a research assistant who was a UCI undergrad who had to return home to Imperial after the shutdown. She was very helpful. The pictures you see in this presentation are from her. In addition, because I grew up in Yuma County, just down the road from Imperial, I knew people there and I have family there. And all of this allowed me to be able to connect with folks, even though I did not leave Orange County. So what did I do? I was able to complete 18 in-depth qualitative interviews over the phone with public sector and nonprofit frontline workers. This included individuals that work for code enforcement, local police department, health agencies, and nonprofits. In addition, because I wasn't able to personally observe at the site, I made public records requests for citations given to individuals for homeless-related infractions and relied on media accounts. In my work, I engage with Michael Lipsky's theory of street-level bureaucracy. The theory suggests that street-level bureaucrats and those workers that are on the front lines of government agencies, and in my case, also nonprofits that receive government funding to deliver services, will often create routines for themselves. This is a response to different factors, and this practice can lead to the rationing of services in a process called creaming. Creaming refers to a process by which one only helps those that are the cream of the crop, meaning that they only help those that are easy cases and most likely to be successful. Previously, this has been identified as happening with social workers and teachers. A common example is the teacher that only gives attention to the, quote, good students and lets the students that might need more help fall through the cracks. Well, my preliminary findings show that this sector in Imperial is consistent with this theory. I find that workers are creating routines that are leading to creaming for three basic reasons: the lack of resources, issues with collaboration and organizational infrastructure, and bias. First, when it comes to the lack of resources, the biggest lack is that of basic shelter. There are some small shelters that help women fleeing domestic violence and folks that are seeking rehab services or just got out of jail. But if you are a chronically homeless, middle-aged person, most likely male, with no children, you will have a hard time finding assistance. This quote is from a law enforcement officer, and it's really telling. It highlights this tension that while there is no place for these folks to go, they are also not allowed to stay where they are. They are encouraged to remain mobile. This is, of course, problematic because there is no way that a person can remain mobile 24/7, which oftentimes means tickets for members of this community. In this scenario, a homeless person is stuck between a rock and a hard place, where there is no place for them to find shelter, and at the same time, they are not allowed on the street. Here is the second finding, which is much more about the organizations themselves. They're engaging in creaming because of an inability to coordinate and collaborate with each other. Here, this participant identifies the issue very succinctly. They state that collaboration and cooperation does not just happen. It doesn't happen just because you have a group of people in the same room. That is, collaboration, cooperation is a skill. It's a learned skill, and it's an educational skill that needs to be done in order for things to function better. You're not going to get a good level of cooperation and collaboration because you bring everybody once a month to a meeting. Finally, they may be engaging in creaming because of bias. This quote comes from a person that works for a program that helps homeless individuals find housing and helps with rent for a period of approximately 3 to 6 months until the person is able to take over the payments themselves. The first hurdle, however, is finding a place to live. They kept making reference to the effort that individuals put into finding housing as the thing that makes program participants successful. But let me read the quote and explain what is problematic in this instance. I provide that to the client, and they just come up with an excuse. Right now, it's COVID-19. So it's just saying, oh, the property managers are not at the apartment. I called them. I don't hear back from them. And sometimes I tell them, you know what? Keep calling, keep following up. And I think sometimes when I provide the information to the client says, oh no, they're not taking applications and they're pretty much booked. when I already talked to the property manager, and the managers say, yeah, we have applications outside of our office. They just need to take one. Once they fill it out, bring it back and leave it in the inbox, and we will follow up with them. It's not necessarily obvious, but this individual is saying that the participants are making excuses and are not making enough effort to find housing because they, as the program employee, are talking with property managers, and the property managers are telling them that there are applications available. However, we know from many years of housing studies that when people who are welfare recipients, a person of color, or a single mom looking for housing, they often face discrimination and might be told that there are no applications. The program employee places all of their faith in the property manager and labels a potential tenant as making excuses. This is very common in housing, and it came up in the study quite often. So what can CARE do to help? Well, we discussed COVID is currently having an extreme effect in this area. And so I separated my recommendations into 2 tiers. I have things that can be done in the short term as emergency assistance and long-term assistance. In the short term, there is a huge need for food. Food insecurity is a big concern, both for homeless folks and the population at large. There's a need for rental assistance for both the homeless and the general population to prevent mass evictions and therefore a bigger housing crisis. In addition, this is a place where CARE's First Responders Assistance Program can help those who really are at the front lines of COVID. In terms of long-term assistance, there's a need for organizational infrastructure support and coalition building between the organizations working on homelessness and housing precarity. CARE could also push for greater policy change around housing in California and the nation, and push for policies to ensure housing as a human right. Perhaps pushing for homeless to become a protected status under federal legislation like the Fair Housing Act. Finally, I want to close with future research and potential actions that people can take. First, in terms of research, I would like to be able to one day return to the original project, which had me comparing different types of informal settlement in Imperial County, which is actually something that has been coming up in the recent days because the organizations and the local politicians are upset that that money that is supposed to go to the homeless are going to people who are couch surfing or living in cars, which they do not see as homeless. And so my initial questions are actually really relevant on the ground right now. And I'd like to be able to see the interactions between frontline workers and residents in order to decipher the role of the state in these interactions. And so the last thing I would like to ask for donations for Spread the Love Charity and the Brown Bag Coalition, 2 programs that do daily feedings for homeless folks in 2 of the larger cities in the Valley. Thank you.